I couldn't imagine, as Bo was lying there, literally close to taking his last breath, if someone had come along and said, guess what? We've outlived your coverage. It's up to you. Good luck.
What is President Biden talking about? I'll tell you. As of right now, around 80% of home care is provided by loved ones working as unpaid caregivers.
When we have to flush his PICC line or clean his PEG tube or take his blood glucose or his blood pressure, none of us went to school for that. I mean, we're not educated that way.
I don't feel like I had enough training at all for this. We've kind of learned by trial and error.
On average, those unpaid family caregivers spend 20 hours a week providing care.
In terms of lost wages, the labor of family caregivers totals about $67 billion annually. That's a workforce that, if it were paid, would rival the entire GDP of Bulgaria.
For most, there aren't many other options for care.
My husband is my primary caregiver. If he were to get sick or called back to work, insurance will not allow me to get a home health aid that they'll cover because of the fact I work full-time.
Whatever other care options are available for people with disabilities, they're not particularly appealing. The system of long-term care facilities and nursing homes is notoriously dangerous, serving irreparable damage to patients' mental and physical health.
Elder abuse, insufficient staffing, falls with injury, broken hip, bed alarms not working, failure to treat, failure to chart, again insufficient staffing, delay in sending the patient to an acute hospital, insufficient hydration, which can cause death, and I believe in this case the woman died.
Don't ever put your loved one in here, ever.
The COVID-19 pandemic only exacerbated these cracks in the system. Nursing homes and other long-term care facilities account for nearly 6% of all national COVID cases, and 38% of all COVID deaths. This past year alone, more than 133,000 people with disabilities died in long-term care facilities. Even before the pandemic, 82% of nursing homes were cited for infection control deficiencies, half of which had recurring persistent problems. It's for these reasons and more that most people with disabilities and seniors prefer at-home care. In fact, nearly 90% of people over 65 said they want to stay in their home for as long as possible. President Biden has asked Congress to fully fund home and community-based care. This is exactly the type of leadership we need.
This is not a pandemic-only problem. This is a systemic problem that occurs constantly, and we need to find a way to overcome these inequities in order to move forward and ensure that it's a more accessible world for everyone.
Americans with disabilities like me and aging Americans need care that ensures we can continue to live independently.
I made a commitment. I will fight for the care and well-being of everyone as if they were my son, my daughter, my wife.
Joe Biden promised that as president, he would make sure people who need care at home get the resources they need to live, and his proposal does that. The work is not done, but this important step forward comes as a result of the tireless work of activists and the integrity of a leader who is willing to keep his word. Join me in telling Congress to pass expanded home and community-based care into law. Will you join us?